Good day, everyone. My name is Ray Finley, nurse educator. I want to show a demonstration on how to start an IV. The best thing about this video that I'm going to demonstrate is that we're going to also do it on both the lighter complexion of the skin and also darker complexion of the skin. This is Mr. Jake. He's going to be assisting me today. He's with the Cleveland Fire Department, and he said that he was also going to help start an IV on me as well. So we're going to take turns. This is going to be a live video doing that demonstration. So in most cases, in emergency situations, an IV has to be started. CPR, also with fluid infusion, are medications that need to be rapidly infused into the body. In most cases, when you start an IV, you want to start from the lower end, which is the hand, and then up to the anacubical fossa, which is in the bend of the arm here. Now, in this case, again, this is for emergency purposes only, so we're going to go for the AC, or the anacubical fossa. So, to proceed, first of all, I want to show you some of the criteria, or some of the material that we're going to be using today. So we're going to start off by, first, the IV, which is the catheter. We're going to be using a 20 gauge catheter. When in emergency situations, you want to use either an 18 gauge catheter or a 20 gauge catheter, the largest you can possibly find. And that will help infuse the medication or the fluids rapidly. Next, to clean the area, you want an alcohol prep. You also want a tourniquet, and during the video I'm going to show you how we apply a tourniquet, and once it's applied, how to rapidly remove the tourniquet without causing any pain to the client or also causing any disruption in the flow of the IV. The next thing is going to be the flush and tubing. So this will connect, and you want to connect that flush or saline tubing to one another. This helps keep the IV site from clotting, and also it's an access for administering medication or also fluids. The next thing is going to be a start kit. Start kit has a variety of things in it, from tape, also gauze, also an op site, which once you have placed the catheter on the arm, the op site protects that catheter. Okay. And also additional gauze, we have that. So once we remove the IV site, we're able to place the gauze on the arm and keep it from bleeding out. So the gauze is very handy. Just have some extra gauze. Okay. So Jake will have a seat here. First of all, the most important thing that you will need in this whole process is gloves. So you get your gloves and go ahead and put those on. Once you've applied the gloves, now you're ready to approach the patient. So by looking at Jake's arm, he has a pretty good vein system here. Again, in emergency purposes, we're going to be doing the anacubical fossa. You have one going here, and you also have one going this way. But we're going to go here to do the whole process. Now, so I did a little demonstration just to show the process of how we're going to do this. Now, whenever inserting the catheter or the IV needle into the arm, you want the bevel up. What I mean by the bevel up, according to this demonstration here, so you have a sharp end here at the bottom, and then it goes upward, and this goes into the arm. Now, if you have it upside down with the bevel down, there's a possibility you could break the vein, and you do not want that. If you break the vein, then we have to find another site. The next thing you want to do is whenever you insert this, you do not want to forcefully go in, because you can also break the vein. So a 45-degree angle is the ideal, but most veterans, they'll go a little bit lower, maybe 20-degree angle, because it's easier insertion. Okay? So if you take a closer look at how I apply the tourniquet on to the client's arm, you want the tourniquet to be right above the area of insertion. So you take the tourniquet, it's going to be somewhat tight. And it's applied. Now, you're probably wondering, why did I tie it this way? So whenever you do an IV site and finish inserting the IV, you want to pull this little tab here and it'll quickly be removed. You don't want to tie a knot in that area. Okay? Next step, you want to clean the area of where you're going to insert. Most veterans, to see the vein better, they will usually ask the client to either pump their fist, and Jake, you can pump your fist there, and you see he has a pretty dominant connection of veins here. All right, or the other one, they'll usually tap that area, tap it. But this is the area that we're going to be targeting right here. Okay. Now, I can say, in most cases, whenever you're doing this emergency, you're rapidly doing something really fast as far as starting an IV. So comfort for the client may have a little bit discomfort, but once it's in, when he arrives either at the hospital, in emergency situations, in the ambulance, or if he has to be in a ICU or somewhere of that nature, that's a perfect access for, again, rapidly infusing fluids or also medication. Okay. So we've already cleaned the area. We know where we're going to target. So the next step is getting everything prepared, which I'm pretty fast at doing this. You do not want the tourniquet to stay on for a long period of time, but you do want enough time for the veins to pop out. So I connected the tubing to the syringe and ran the fluid to the end of the tubing. All right. So now we're going to prepare for insertion. And again, the angle is very important. Very important. All right. So you want to pull the skin back, and once it's pulled back, you'll be able to insert the IV. And if you see how the blood fills up the chamber, that's how you know you're inside the vein. So what you'll do, you'll advance it in and pull that needle all the way out until it locks. That's your safety. Once you've done that, remove the tourniquet. Do not remove this Cathlon yet until you know you have it in. So this is the tubing that's going to connect to the end here. You want to apply pressure right above the Cathlon, because again, you're going to be removing this needle. looks like on the skin. Gotcha. So once you've applied pressure right above that area, then you want to connect the tubing to the cath line. Pull back a little to see if you got any blood return. And then it should flow easily. Once it's in and it starts to flow, then you know you're exactly into the vein that you want. Okay? So now the other part is where you want to support it. Once you've disconnected this portion of the IV, once you've disconnected it, you want to support it. And that's the op site that I showed you earlier. And they come in different sizes and they also come in different shapes. So the op site that I have showed before, they have one that looks like this, but they also have a plastic one as well. Okay? So now, let's do the removal. Sharps. Once this is locked, it's most likely not going to retract and show the needle. But you always do not want to leave this cath line out without throwing it away, which you put it inside of your, you actually put it inside a sharps container. So the sharps container is key here. Next, to remove. You want to take your gauze and apply it to this area. Remove this, which is going to be your op site. Apply pressure to that area. Once you apply pressure to the area, you want to remove the IV and hold pressure for at least 10 to 20 seconds. 10 to 20 seconds. Again, this will go, even though it's not sharp, it has blood in it, so you also want to place this in the sharps container. Okay? Once that's applied, you want to take a piece of tape and place it onto that area. Again, to keep any infections or also keeping it from bleeding. So now, next step, we're going to do it to a darker pigmented skin. So Jake's going to be the person to do so, and we'll go from there. Now remember the steps that I showed you. I'm also going to be just instructing, and you'll hear my voice in the video as well. But he's going to show you the technique that's being used for darker pigmented skin. Remember, with darker pigmented skin, palpation is key. Just to make sure, for sharps, our sharp container is not here, but we're gonna just put that to the side there. So he's preparing everything to start the IV. The same steps that was demonstrated earlier. That's what we're gonna do. So Jake's also using the same catheter that I used on him earlier, which is a 20 gauge pink colored catheter. And again, 18 to 20 is usually the sizes that's used for emergency purposes to infuse medication or fluids. So just like I did earlier, he's using the tubing and also the syringe, the 10cc syringe, and he's flowing it all the way to the end of the tubing. Because remember, this is where the medication is going to be infused through, and also the fluids as well. All right, so he's using the same technique in the tourniquet for a quick release, and so I'm just getting it ready for him to be able to infuse. The next step, he's cleaning the area where he's going to apply the IV. Plus, it also has a good visual on where the vein is located as well. A good visual. So he's clean. Even though he palpated, remember he re-cleaned the area just to make sure that no debris or anything like that from his glove or anywhere else is present. So he's going to go ahead and remember a 45-degree angle is textbook, but a 20-degree angle is always a good one. So he got a flash, so that means that it's in. Once it's inserted, he'll apply pressure. He'll take the tourniquet off, and then he'll apply pressure at the top. So even if the cath line comes off, say if the needle falls off the cath line, it's still not going to bleed out. So what he'll do, he'll check for patency. He pulled it back and there's blood return. Also, he's actually pushing the fluid into the IV site, and then he locked it to obtain patency. And that's the op site, and that's to help support the actual cath line. And once it's in, he can actually remove the syringe. And so this end here is the end that's going to actually have the medication or fluids placed inside the IV. The extra tape, perfect job there. And again, for emergency purposes, this is ideal to do. So now he's going to remove the IV. He's already the sharps. He knows where his sharps is, and he lashed it all the way out, so he can't stick himself, and he knows where it's located. But whenever he's done, he'll take that sharp and put it in the sharps container. That's the most safest thing you can do. So he's applying pressure, and he's removing the cath line from the site, holding it about 10-20 seconds. Applying enough tape to kind of support it. And again, this is the demonstration for IV access on both light and pigmented skin. Thank you for your time.